these autistic kids have some common things that plague them. And most of them have the same kind of bacteria living in their gut. We now know that the bacteria, these trillions of microorganisms that live in our intestinal tract, these are not innocent bystanders. These creatures are metabolically active, and they put out their waste products, their byproducts, are molecules like dopamine and norepinephrine and aminobutyric acid. These are neurotransmitters. They get into our bloodstream and they change our brain chemistry. Well, it turns out that a tremendous number of these autistic kids have been given antibiotics in infancy for ear infections or skin infections, and as a result, over half of them have a particular sort of bacteria that live in their gut. And then the question is whether these are playing a role, because there have been numbers of studies showing that giving these children an antibiotic often produces a great improvement, which demonstrates that these microbes are probably playing a role here, and that a whole food plant-based diet changes your gut flora. Within days it changes. And there's no, if you have an autistic kid, the worst thing to do is feed them the Skittles and the chips and the sugars. Get them on a whole food plant-based diet, maybe some probiotics as well, change their gut flora to appropriate, and see what happens. It's, I think, a reasonable thing to start, and I wouldn't be surprised if we start seeing it as the foundation for autism treatment.